Aileron 6924 is actually a novel agent. It's a stapled peptide that specifically and selectively inhibits both MDM2 and MDMX, which are critical regulators of p53 function. MDM2 inhibitors in general have shown activity in AML and MDS patients, but again, the goal of this trial was to look both at the safety and sort of early efficacy of Aileron 6924, both in MDS and AML patients. The design, there were two cohorts. There was a combination cohort that we ran. Again, so this was with weekly Aileron 6924 with low-dose Cytarabine between 100 and 200 milligrams per meter squared. It was given on a weekly schedule, 3 weeks on and 1 week off. Additionally, we have a monotherapy cohort. Again, this was with Aileron 6924 by itself, given 3 times a week, basically 2 weeks on and 1 week off. As far as safety, we do see typically grade 1-2 nausea to be a frequent occurrence. We also do frequently see hyperbilirubinemia. This is an on-target known side effect of the medication. We've been able to continue dose escalation in the combination cohort, and overall has been very well tolerated with really only one dose-limiting toxicity to date of angioedema. In the combination cohort, we have seen responses, including 2 marrow complete remissions in patients who have myelodysplastic syndrome, additionally some other stable disease patients who had blast reduction as well, and again, overall tolerated. In the single agent cohort, dose escalate, in the monotherapy arm, dose escalation is continuing. Again, overall has been safe. We did have dose-limiting toxicities, and so ended up dose reducing again with dose escalation ongoing. One of those dose-limiting toxicities in the weekly, or in the 3 times a week cohort or monotherapy was grade 5 cytokine release syndrome, which we are now prophylaxing all those patients and have not had any recurrent tumor lysis syndrome. Data are still early as far as efficacy, and again, the dose escalation is currently ongoing as we speak, and additionally, we are particularly expanding the weekly combination for myelodysplastic syndrome patients.